Is the United States prepared to deal with the coronavirus? The short answer is no. While other countries have tested hundreds of thousands of people for the virus and millions in the case of China, the US had only tested about 500 people as of March 2nd. Again, compared to millions in China. But that's only part of the problem. America's healthcare system is touted as the best in the world, but the ugly class character of the health delivery system makes it far less capable of dealing with an epidemic or a pandemic. In recent weeks, the White House and US mainstream press has spent more energy whipping up hysteria and criticizing China, which took dramatic and proactive measures to contain the spread of the disease, instead of developing ways to address the potential danger of the virus spreading further here in the United States. There are more than 100 cases of the coronavirus in the United States, with 6 confirmed deaths. But because so few are being tested, the number could already be in the many thousands. And not only has the response from the Trump administration been totally inadequate, the reality of living under a healthcare system driven by money instead of wellness is leaving literally millions of people vulnerable, and that means that we are all at risk. The Centers for Disease Control has cautioned people to see a doctor, work from home, or to take time off of work if they're feeling sick. And that's great advice, if you can afford it. But people who work in retail, childcare, other service industry jobs, or who work in the gig economy are far less likely to be able to work remotely, have health insurance provided by their employer, or have paid sick leave. 7 out of 10 low-wage workers in the US have no sick days. Remember that number. 7 out of 10 low-wage workers can't miss work if they're sick, even if it's the coronavirus. And this is not only an issue that impacts low-wage workers without sick pay. According to the census, in 2018, 27.5 million people did not have health insurance coverage, an increase of nearly 2 million people from the previous year. So let's go back to all those workers who have no sick days at all. Again, 7 out of 10 low-wage workers do not have paid sick days. That is a huge number of workers. 42% of American workers are low wage. 42% make less than $15 an hour, according to the National Employment Law Project. We're faced with the stark reality that millions of people in the United States simply cannot afford to tend to their own health. Health experts are saying that poor and working class communities will be much harder hit by the virus than more well-off communities, meaning that wealth gaps created by capitalism could literally mean the difference between life and death. Because what are you going to do if you don't have sick days and you're only showing mild symptoms? And that's not uncommon with this coronavirus. You're going to go to work and potentially infect others. If you miss work, you're going to be fired. And with no job, you can't feed your family and you might even become homeless. To fight the coronavirus, every worker must have adequate sick days as a human right. Every person must be guaranteed access to free or affordable healthcare. These are not utopian or radical demands, even though that's how they're treated by Wall Street and the capitalist-owned media outlets. In European capitalist countries, all political parties agree that such a healthcare system is required. It is only in the United States that the capitalist class expresses such undiluted greed that the working class is denied these basic rights and services. All the more reason that we need not only a political revolution, but a social one as well.